At Loyola Medicine, we use the latest technologies to help treat and diagnose bladder cancer. An integrated team of experts, including medical oncologists, radiation oncologists, and urologic oncologists, provide multidisciplinary care, ensuring the best outcomes for our patients. In 2018, 80,000 cases of bladder cancer will be diagnosed in the United States. It's the fourth most common cancer in men.
The most common type of bladder cancer is called a urothelial carcinoma. That represents about 90% of the bladder cancers that we see in the U.S. The most common risk factor for that is smoking.
Treatment options for this type of cancer include upfront chemotherapy followed by radical cystectomy, which is removal of the bladder and the lymph nodes in the pelvis. Patients are candidates for open radical cystectomy and robotic radical cystectomy. With the advancements in technology, robotic surgery is being used more often.
Once the bladder is removed, we have to find a way of getting the urine out of the body. And so one of those approaches is to create an opening on the abdomen where the urine can drain out continuously into a bag. Another approach is creating an internal pouch for the urine in which the patient catheterizes through an opening in the abdomen. The third option is an orthotopic neobladder. It is essentially creating a new bladder out of the patient's intestine, so they will then urinate normally without the need for catheters or bags.
Each option has its own advantages and disadvantages, and we have this discussion with the patient to tailor this to their lifestyle and their desires. Mr. Clark was referred to me with the diagnosis of bladder cancer.
He came on very strong, very confident about everything.
He made us feel that he was going to be there with us all through the fight.
He was very confident that after the surgery I'd be looking forward to at least another 20 years, which made me feel pretty good.
And we find that patients who have good support systems often do better.
When you go through something like this traumatic in your life, it's great that you can have someone who's there. I consider myself very fortunate because of that.
At his 5-year follow-up, Mr. Clark remains cancer-free and is active, and his prognosis is excellent. It's extremely rewarding and gratifying to take care of patients and to be involved in Mr. Clark's care.
The care here has been fantastic.
Here at Loyola, we've really become a center of excellence for bladder cancer care. We offer a multidisciplinary approach to the treatment of our patients.
This is what Loyola helps us do. It gives us the ability to see these patients, to treat them, to employ technology, to better their lives, to better their outcomes.
I have great faith in Loyola. They will help you there, not only physically, but spiritually.